Starting tomorrow, some elective surgeries within certain URMC hospitals are set to be put on a pause as a nationwide IV fluid shortage persists. It all stems from a manufacturing plant in North Carolina getting damaged by Hurricane Helene right at the end of September.
Yeah, hospital leaders gave greater detail about their plans to manage all of this. Isabel Garcia joins us in the studio with those details. Isabel.
Yes, good afternoon to both of you. Hospital leaders also expressing deep frustration over this for their patients and staff alike, also stating as a major trauma 1 center, burn center, and the pediatric care at this level, it was an essential decision to ensure safety for the most critical patients. A national shortage of IV fluids is causing URMC to delay some elective or semi-elective surgeries starting Wednesday, October 16th at certain UR hospitals. The company Baxter, which supplies about 60% of the country's IV fluid solution, was severely impacted by Hurricane Helene more than 2 weeks ago. Patients deemed safe to postpone are being contacted directly and do not have to reach out to their surgeon.
Tomorrow is the first day that we'll be limiting surgery, and it affects about, for the next 3 days, about 50% of our patients undergoing surgery, or about 100 patients.
UR Medicine officials say they are working to get additional supply from different vendors. The U.S. government approved use of fluids from international suppliers, which we learned Tuesday has its own complications, whether it be transporting the supply here or the language translation on the labels. Dr. Jim McDonald is New York's health commissioner who recently weighed in on the shortage.
This is going to be a dynamic situation that's going to ebb and flow for the coming weeks. What Baxter has said is this won't resolve fully to the end of 2024. I think one of the things we need to keep in mind is some of the things Baxter's doing to increase supply is, they're a global company. They're in 53 countries, but they have 7 countries where they've already increased supply, so there'll be international imports.
Since it's a national shortage, U of R could make its own solution. This is something Chief Medical Officer Dr. Apostolakis says is not a long-term solution, as the demand on a daily basis outpaces what the hospital system could manufacture.
We are limited in several ways. In order to make the IV fluids, you need some base fluid, and that's in short supply. You also need bottles or bags in order to make it, which is also in short supply. And then there's also limited area to which we can make it, and limited staff to work on it.
Now, the medical system overall says it is taking, of course, innovative steps to conserve IV fluids they do have. This includes utilizing a push method for antibiotics as opposed to IV. So far, some of these efforts saving about 20% of the supply. Now, while this is being reviewed by a team on a daily basis, this is all roughly expected to last at least the next 2 to 4 weeks here locally. For now, reporting in studio, Isabel Garcia, News 8.